start. So this is in this presentation, we'll be discussing principles of forensic practice. So we'll explore the key topics such as forensic evidence, role in professional in court, and the intersection of forensic science and the law. Can we, as I told you, legal system vary in different countries. Fiji is different in US different in Philippines different in Fiji. Sorry, those are the only three countries that I have seen. I haven't been in Fiji or US, but I'm reading their justice systems. Next, professional must adhere to relevant laws and professional standards. And accurate evidence is crucial in investigations. Why did this move? Okay. You need to prove guilty beyond reasonable doubt. Okay, the example I was giving you, you were in Marine Drive having class. I am in Saweni. What's the time? 10:44. Let's say someone stabbed me at around 10:45. And a man was being what's this? Is suspected. Can we suspect a man? What if he left the room at around 10 o'clock, came back at 11:30? Can we still suspect him? A man, yes. Can you be suspected? Oh, alam ko iyo. There. A man, can you be suspected? Huh? Why? You left the room at 10, came back at 7:30. 10:45. Yeah. Yeah. Unless someone saw you that you are still here at that time, you understood. Okay, legal systems. Laws are rules that govern society. In England and Wales, the judiciary is independent of state control. Common law evolves through judicial decisions and statutory law. What do you mean by statutory law? The state law. Sorry, the book that I'm using is English from British. Yes, Simpsons. So mostly it's more like that. So the state law or what governs their society is the rule there different from Fiji somewhat, right? Criminal law. What do you mean by criminal law? This is Okay. If a police caught a criminal, can they say it's murder? Okay, I need this now. Can they say it's murder? What do you think? What do you think? Can a police tell that it is a murder? What are the kinds of death? Do you know? Manner of death. Again? No. The manner of death is number one, natural death. What is natural death? Old age, like that. Disease. Next, accident. Uh, sorry, but you cannot. I'll be blunt, uh, direct here because it needs to. I don't know if because I'm uploading this in YouTube, not in because I'm recording through PowerPoint now, not in Google Meet. So accidents were in. Okay, let's enumerate first. Then I'll give the example. Natural accidents, suicide, murder is not part of manner of death. Murder is is only said if the court say it's murder. It needs to be proven by the court. Homicide. Two more. There is unknown and undetermined. Natural. Old age. Pathological sickness. Next. Accidental. It's like, who knows Brandon Lee? Brandon Lee. The son of Bruce Lee. Remember during shooting, he was shot. Vilgan. That's accidental. Next, suicide. Robin Williams. Next, homicide. For example, a man stabbed me. That's homicide. Next, unknown. I am riding in a bus, and suddenly the bus uh, nearly jumped on the cliff. But it's a good thing that I was in front of the bus. Then it's a good thing that the bus stopped on time, right? But I died with a heart attack. Is the bus driver there liable? Okay. Is my heart attack becomes a natural death? No, because it was okay. That's unknown. What's the last one? Undetermined. Who knows Atlas? Anyone knows Atlas? No, Atlas. Anyone knows the Atlas? How many years? This year, fifth year, right? You forgot Atlas? Yes, the skeleton in.
Oh,
the-
yeah, yes, we know Atlas.
Yeah. You forgot Atlas?
We know.
For example, you found the skeleton there. What's the cause of death? Why?
Too long to make any
Uh,
reasonable assumption.
can you investigate and give a cause of death, manner of death?
If the skeleton suggests whatever remains, if it suggests, say, for example, if he has a hole in his skull, then we can assume that it's something to do with blood or trauma or predatory holdings.
Wait, hole in the skull. Describe the hole. Describe the hole in the skull before you say it's a blunt force trauma or.
It's a crush injury, so it's fragmentation instead of a clear demarcation.
So fragmentation, if fragmentation, broken skull, not hole. Because if a hole in the skull, there's two things. It can be gunshot wound or you stab. I have done an autopsy of a hole in the skull. During one time in the Philippines, there was a mass stampede because one of the bleachers in a anniversary show gave way. So from top going down, they fell. It fell. And one of the victim there, when I autopsy it, still when I saw the body, there was still a stiletto on the skull. You know what a stiletto is? The heel. The very, very heel. Right? Yes. I don't understand why they are wearing stiletto on those kinds of events. So criminal law, mostly it's to give a high burden of proof. Again, what's the saying I told you a while ago? You need to prove it beyond reasonable doubt. Because if you cannot prove it, you cannot give, you cannot say that the person is a criminal. Yes. I have watched this movie. It's in the Philippines. He was sentenced to 50 years in prison. But in his 20 years, it was proven he was not the one who made the crime. So what will happen? Right? What happened to the 20 years? He has children and the children didn't see him because yes. Mm. And in the Philippines, if you are convicted, it's hard for you to get a job. Let alone after 20 years, you're old. You understood what I meant. So the prosecutor must prove the guilt beyond reasonable doubt. So includes the magistrate, the courts, crown court, youth court, the jury. If there's a jury, who the jury is what?
Unbiased.
Unbiased, right? But what if in the jury there's one who is saying he's not guilty and the rest is saying guilty? Right?
No, like some
it's not a majority. It should
It has to be unanimous.
consensus.
It has to
Yes.
be everyone deciding it or no.
Yes. There are some jury wherein they don't want to prolong the court sentence. They unanimous what? Say it's they're guilty. We're talking in the US, eh?
Yeah.
Civil law. These are dispute. Small disputes, small claim. How would I give an example? Family law. Who will be no, not okay, inheritance or mother is asking for
Alimony.
not alimony but support for the child to the father.
Child support.
Yes, child support claim. Those things. This include what? County court, family court, high court divisions. Healthcare professionals and the law. This is more on uh, healthcare professionals. Why? What is the extent of sexual harassment or sexual abuse to a, how would I place it? Sexual harassment or sexual abuse to a person doing CPR. A male health professional responder doing CPR to a female. There was a case I heard last December. The male was doing CPR. The male, who is a licensed responder, licensed first aider, wherein that male took off the bra of the female.
Isn't there a law that says that you should take the bra off in order to get good chest compressions? Because
No,
no,
there's no
no
law.
law.
That's the rule.
There's a rule. Yeah.
There's law is needed to amend it. Sorry, we're in forensics, so mostly I'll be really looking for the specific word. You need to
Thank you.
not take it off, but we need to release the or make it free. How would I place it?
Release the tension.
Yeah, something like that, right? One time I was watching a in social media. You know what Karen is? Karen.
Karen.
Yes.
Yes.
What's the counterpart of Karen? Yes. Ken. But now I don't know because they said Karen is too obvious now. They changed it to Jessica. There was this interview to that lady, quote and unquote. CPR is an excuse of a guy to sexually harass or abuse a female victim. Question. Do you agree?
Sorry.
Do you agree?
I plead the fifth.
Any judge will say, you're thinking of sexual harassment, that guy saved your life. Right? So,
But in an emergency, you can't really wait for a chaperone, can you?
yes.
Is that an extenuating circumstance in which it is okay? Or no?
Depends on the court.
Then,
Yes.
what about the Fiji court?
Ah,
About the court here?
uh, from what I heard from that case, the guy, the judge, I think, closed the
Yes,
case, dismissed the case. Again, must provide factual and unbiased testimony. What if you did a CPR, then the rib cracked?
Fine.
No.
Really?
Yes. First thing the judge will ask to the person who's giving the CPR, are you licensed?
Yeah.
If you're not licensed, that's not
That's
okay.
not-
But if you're licensed, you understood what I'm saying.
I like, so, like in I don't know if we have this thing here, but once you get CPS certified, you get a card,
Again, yes.
a card that certifies you. If you have that, then you're good. That protects you from litigation,
Mm-hmm.
from for exactly these kind of things.
Actually, the one that I told you, he has a card.
Here's a card.
Wait, I will show you. I can't find the picture, but hmm, I think I need to pass it from here to there because Aman was just looking. It's 3 years license. That's not me. That's my son.
Yeah.
To date, I think he's the youngest first aider. But for the record, I'm the youngest first aider. I got my first license to do first aid, including CPR and everything, at the age of 10. Yes. Professional witness. What's the difference between a professional witness and a witness?
Unbiased.
Unbiased and what?
Uh,
License? I'm looking for that word. Okay. What's the difference between an expert witness and a professional witness? Mm-hmm.
Would it be like say professional is somebody related in the workforce, like with the
Something like that.
like
For
a
example,
work colleague?
health. What is healthcare? They can call anyone from the healthcare. But for example, don't want to give this example because to tell you frankly, I don't want really to be something like that. There was this case wherein we presented that case is mostly something like the person was, how would I place it, naman?
Not too sure.
How would I place it? It's an autopsy case wherein I presented. Then the patient died after 6 months, given 90 bags of blood. Yes. Autopsy, we saw tumors. So it's metastatic. Upon admission, you need a chest X-ray. When I was looking at the chest X-ray, it was faint. If you are not used to look at chest X-ray, it's hard to see. Then what happened was on that chest X-ray, there was a cannonball lesion, both sides. But they ruled in as normal chest X-ray. So what is that? What will be the problem? that ca- that cannonball lesion is a what? Metastatic lesion already. If that cannonball lesion was seen early, I think the patient can be saved. No, not can be saved, but can prevent that 90 pints, 90 bags of blood, those things. But nah. So, professional witness, these are people who are in that workforce, but expert witness, for example, they need someone doing surgery. Should they get an internist as a witness? You understood what I meant? You need what? A surgeon who is well versed in their field. So this is the expert witness, provides opinion based on expertise. The expertise established through education, training, and experience. And again, must give unbiased and impartial assessment. Do not say anything, in my opinion, if you become an expert witness. Give what you know about that field. You understood? Evidence in court. This must be what? Truthful and accurate. The process includes examination, cross examination, and re examination. What do you mean by examine? Ask the person there at the stand. Cross examination,
The other
yes.
examining.
Re examination, go back again.
For example, there's two people on the stand, or like there's two parties. So there's say, for example, in a civil law, if you have an offending party and the offended, then you have the right to examine your witness. So that's your examination. But the cross examination will be done by the other parties, like other team or other party, to examine the witness from the other. And then
Yes.
re-examination can be done, I think, with someone else, like someone else.
Okay.
Sure about the re-examination.
Okay. So that's how to present the evidence. When you present an evidence, present first, then someone will ask about that evidence, and again, re-examination of that evidence. Judge may also question the witness at any time in any court proceedings. Medical reports must be accurate. That's why what's the first thing you need to do in a medical report? In short, there. Yes. Then the history. I think yes. Then your examinations. So consent from the patient is often required for medical records. Why? Consent from the patient is often required for medical records. Why? Yes, that's confidential, and if it's needed to be
Discuss on the
discussed, it should be the uh, there will be a consent from the patient. Standardized protocol ensure consistent reporting. Yes, in forensic, you need to do step one before you go to step two, three, four. You should not skip every step. So, in conclusion, forensic practice requires adherence to legal and professional standards. Professional must provide unbiased and accurate evidence, and collaboration between law and forensic science ensure this justice. Do you agree with that? The evidence doesn't lie. If the evidence is correct, yes, doesn't lie. If it's tampered, that's the problem. I'm using
So,
Simpsons.
do you have the 14th edition?
Ah,
Do you have the 14th edition? I have 13th.
where did you get the 13?
Senior student.
Who's that senior student?
Sister.
Okay. I know because the 14th is I just got it last year. I have the 14th, I think.